Now, what we can do as we get about midway, we can just get Dean to bring his foot towards the table a little bit. That's it, that's enough. Now, once again, just a little bit of movement, not too much. If we get too much, then he'll push us out. And we'll take it all the way up, like so. Beautiful. Now, if you're very clever, a little bit like I do, you can actually engage the tissue a little bit with your own knee underneath here as you're working through. But it's important that you get that pressure right and that you're working as much of that tissue as you can. All the way up. So normally I would do at least 5 to 6 good purposeful sweeps along that. And then I will make my way up here to this area here. So if you find the AIS, okay, which is literally about there, if we come just down about a finger width or two below that, onto the sort of just at the point of the musculotendinous junction, so it's in this area here, this is where the trigger point is, okay? That trigger point there refers to the top of your kneecap. Now, in terms of engaging this trigger point, the easiest way for me to do this is a broad pressure in with my elbow. Now, yes, you can come this way and do it, but to be honest, I actually like to come this way and do it more so this way, okay? So what you've got to do is find almost the tendon itself. You find the AIS, the bony prominence, and so you work across, up and down until you find that trigger point. So there's a little bit of toing and froing with it, but once you find it, it will refer all the way down into that kneecap itself. So we just, I reckon that's about it there, Dean. It's quite sensitive there. So you usually will feel almost a little sulcus into it. So a little hollowing, if you like. So you can just sit on that there. Not too deep, once again, comfortable. If it's too much, he'll be pushing you out, so we can just sit on that area there and just relax and let the trigger point just dissipate. So it might take 20, 30 seconds, might take a little bit longer, but you want to make sure that you're supported, you've got the shoulder over the elbow, you can sit here for a while and you're just using your body weight as the pressure. Okay, so that's the trigger point for Ric Fem. As I said, refers all the way down into the kneecap beautifully. All right, so offloaded the tension, try and improve a little bit of that range of movement. If you can get them to tuck it right under and hold that there, and then you'll basically find that will improve that range of movement. So when I say that you improve the range of movement, it's not like you're going to all of a sudden increase the ability for them to go even further. It's more about the quality of their range of movement. So you might be able to get to, full flexion, but that last 5 degrees of full flexion just feels tight. And that's what we're aiming at improving. Now, another little trick of the trade that not a lot of people are aware of, but I wanted to bring this up, and that is that every now and then we can get a trigger point that develops in the superior portion, okay, just up in this area of the patella tendon. So this is the superior patella tendon. This is the inferior. So we get a trigger point that develops right in there. And this is great. Once again, you can use this for a whole myriad of knee conditions. So what we're going to do is I come underneath and support the back of the knee. I come over the top. Okay, so there's the patella tendon there. So I come over the top and I sink down and then I move inferior, superior, lateral or medial to pick up that trigger point. About there, Dean. Yeah. Yep, you feel that there. And I just sit here and I wait for it to dissipate. Now, once again, the art in doing this is just the sit and wait and not push too much. So this, you won't find this trigger point in any of the text anywhere. It's just one of these functional trigger points that just, for whatever reason, is a bit of a shown to me by an osteo colleague of mine, and it's an absolute ripper of a trigger point. And in terms of improving knee function, definitely, especially post-operative knee pain, fantastic. ACL repairs, all that sort of stuff, trying to get that flexion back, works an absolute treat. So that's the trigger point in the superior patella tendon. Where does it refer really depends on the person, but usually can refer medially, it can refer lateral, can obviously be more central, sometimes it may even refer up, but please put it in your repertoire. Absolute ripper. Right, so that's Rec Fem. Now while we're here, the next muscle that I'm going to work will be the Vastus lateralis. Okay, so can you just push your foot up against me? There we go, there it is. Big muscle. Obviously the ITB sits right over the top of it. There's the ITB. Okay, we go underneath there. So that's how broad Vastus lateralis is. Have you ever seen the bodybuilders? They've got huge Vastus lateralis, especially when they do a side pose. It's massive, or track cyclists for that matter. So there are many trigger points in Vastus lateralis. The ones that I focus on the most are the 4 that are clustered together in the lateral part here, just above the knee. So you may have 2 anterior, and then you'll have 2 posterior. However, to get to the posterior ones, you actually have to push the ITB down and out of the way. So you can see there's the ITB. So the anterior ones will be here. The posterior ones you have to push ITB out of the way and then sink in from there.